Miss Swenson.
Hey, Tamika.
Hey.
I'd like to follow you on to your next patient.
Sure, no problem.
Can you give me a rundown on the situation?
Yeah, my patient's admission orders are to do a culture of the wound before her antibiotics are started.
That's right. If a wound appears to have signs of infection, it may be necessary to do a culture in order to determine its cause.
Why is that exactly?
Identifying the invading microorganism helps us determine treatment options and select the most appropriate treatment. That's why it's so important to maintain strict asepsis.
Right.
This will help identify only the pathogen present in the wound and prevent external contamination.
Well, I've got all the supplies we need.
Looks like you're ready. Let's do it.
Okay. Hi, Miss Olshan. Hi, I'm back.
Good to see you.
This is my instructor, Miss Swenson. She'd like to observe today. Is that okay?
Oh, it ain't nothing. The more the merrier.
Okay. What we'd like to do is take a culture of your wound to make sure we give you the best medication for your infection. So can I do that now?
Oh, well, I'm not going to argue with a professional.
Okay. Well, I'm going to clean my hands.
Thank you. It'll help us make sure we're giving you the most appropriate treatment.
Okay, Miss Olshan, what I'd like to do is clean the wound, get a culture of the wound, and then redress you, okay?
Sounds good to me.
Okay.
Always make sure you have the proper culture swab, Tamika.
Okay. I'd like to check your ID band, okay? Tell me your full name, please.
Tabitha Olshan.
Okay.
You see, I'm a dog person. I've never been into cats. Oh, their little eyes, they're always thinking about something. And you know they're not thinking about if you're happy the way dogs do. Oh, no. They're always plotting something. Apparently, I got a little too close when it was hatching its plan.
Yes, you did. Let me reposition the bed to make it easier for me to remove the dressing and clean your wound. Okay.
Thank you.
Okay, I'm just going to put this waterproof pad underneath your wrist. Thank you. Okay, all cleaned up. Now I put on clean gloves.
Check the label against the patient's ID.
Then I twist the cap to loosen the swab in the culturette tube, making sure not to contaminate the swab or the inside of the culturette tube.
Very good.
Then I carefully insert the swab into the wound and roll it to obtain a sample.
Now, Tamika, since you have a second wound, you'll use an additional swab to obtain the other culture.
Okay. Now I'll carefully replace the swab into the culturette tube, making sure not to touch the swab to the outside of the tube, and secure the cap.
Very good. And place the label on the tube.
Now I'll get these gloves off and replace your dressing.
Are you going to get me Thousand Island instead? Or blue cheese?
Just a couple more minutes, Miss Olshan, and we'll be finished, all right? Okay, Tamika, you've replaced the dressing.
Right.
Now you should label your specimens with the date, time, and your initials.
Okay.
Then we'll put them in the biohazard bag and send them to the lab. And of course, you'll want to document the procedure, your assessment, and the patient's response to the treatment in the chart, which is at the nurse's station.
Okay.
Thank you. Great job.
Thank you.
Thank you, Miss Olshan.
Thanks,
Take care.
Miss Olshan.
Now make sure you come back. My door is always open.
Thank you.